The clock is ticking. The deadlines to register for Medicare and for healthcare under the Affordable Care Act are almost here. You're looking at Monday, December 7th for Medicare, Tuesday, December 15th for the Affordable Care Act, and it's all going to be here before you know it, of course. All right, so we're going to help answer any questions that you might have in the last couple of weeks. I'm joined by Josh Peck from GetAmericaCovered.org and Dr. Catherine Savier. She's president of the AARP North Carolina and co-chair of the North Carolina Serious Illness Coalition. How do you get your question answered in real time? You do it by texting. So you'll text the number 336-379-5775. Again, 336-379-5775. And that way you can get your questions answered. Okay, first and foremost, let's just go over those enrollment dates one more time. So let's tackle Affordable Care Act first. Josh, that deadline is the 15th. When on the 15th, what do they have to have done?
That's right. December 15th is your last chance to get coverage for 2021. If you miss that deadline, you'll have to wait until almost the end of next year before the next open enrollment period. So be sure to go to healthcare.gov and enroll by December 15th.
And the only caveat to that is if something changes in your life, like you get a job, you lose a job, you have a child, something of that nature.
That's right. There are qualifying life events. If you lose your job and you lose your health coverage along with it, you'll be eligible for one of these special enrollment periods where you can get covered. But those are really difficult to count on. And if you need coverage now, you should go to healthcare.gov and enroll.
All right, Catherine, let's talk about Medicare. So enrollment again starts on Tuesday, and that is December the 7th.
It ends.
That was a Wednesday, right? Okay, so what happens in that time?
Well, at that time, after that time, you're ineligible. And the caveat with Medicare is that they have very strict rules about when you must sign up. Again, there can be life-altering situations that make you qualifying events that make you eligible again. But for the most part, you need to be done by the 7th.
Okay, and I want to be able to bring up a graphic that we have that talks about when you should apply for Medicare for the very first time. And a lot of people say, well, I don't need it right now, so because I'm still working. But let's put up that graphic because it shows that when you're about to turn 65, you need to apply for Medicare. You can do that the 3 months before your birthday, the month of your birthday, or the 3 months after your birthday. But if you don't do it in that time, you're really going to pay a penalty.
Absolutely. And you pay the penalty not immediately, but you pay it for the rest of the time that you are on Medicare. For example, if you choose to not take Medicare Part B, which is what pays for your outpatient visits, your doctor visits, and then later decide to try to take it, you will pay a premium for that's higher for the rest of the time that you're a Medicare recipient. And that's not something that any of us want to do. So if you're still working, you still need to sign up and make sure that your paperwork reflects the fact that you're still working and you have employer insurance.
Okay. All right. We're getting text questions. This question says, I'm waiting on my disability to be approved and estimating what my income would be for 2021. What happens if I get ACA insurance and don't get a W-2 to do my taxes? What will happen?
Well, what I would recommend for this person and for so many people in their situation where, you have complicated circumstances that might make filling out, your application or your taxes a little bit harder. I'd call 1-800-318-2596, where you can get a trained professional at healthcare.gov to walk you through your healthcare application, answer any of these questions that you have, or during tax time, they can help you with your health-related questions as well. That number is 1-800-318-2596.
And I believe we have that in our web story as well. So you can go to our web story and be able to find that. All right, this is a Medicare question. My husband's turning 65 this year. He currently has a Humana Medicare supplement plan because of a disability. Does he need any more coverage as he turns 65? Should he also be getting Medicaid?
Well, Medicaid is a very different benefit, and that one is very income driven. Because he's disabled and he has a policy, he may want to check with the SHIP people, the Senior Health Insurance Information Program, to find out whether or not that particular disability plan would cover as a supplemental. But what he's really looking at is Medicare because of his disability, and then having a supplemental policy to pay for the things that Medicare does not pay for. And he needs to be very careful to make sure he doesn't, again, miss one of those opportunities to make a transition if he needs to.
Okay, and that SHIP phone number is also in our Two Wants to Know section in that very same article. So it's kind of one-stop shopping for all of you who are watching right now. We're going to take a quick break. We'll be back with more of your questions.